the new era of epilepsy management, 2025-2026. What if epilepsy treatment could move beyond guesswork? For decades, seizure management often relied on trial and error, trying one medication after another until something worked. But today, a major transformation is happening in neurology. Welcome to the new era of epilepsy management, a shift from empirical treatment to mechanism-based precision care. This infographic explains the major changes shaping in epilepsy care in 2025 and 2026. At the center of this transformation are what experts call the three pillars of the 2025-2026 shift. These pillars are 1. Diagnostic mapping, 2. Genetic precision, 3. Third-generation pharmacology. Together, they are redefining how clinicians diagnose and treat epilepsy. Before vs. After. On the left side of the image, we see the old model of epilepsy treatment. This approach is labeled trial and error. Patients were often prescribed different anti-seizure medications one after another, hoping one would eventually control seizures. This method could lead to delayed seizure control, unnecessary side effects, frustration for both patients and clinicians. But the right side of the image shows the future. Mechanism-based precision care. Instead of guessing, clinicians now aim to understand where seizures originate, why seizures occur biologically, which therapy targets the underlying mechanism. This is personalized neurology. Pillar 1, diagnostic mapping. The first pillar is diagnostic mapping. This involves using advanced technologies like high-resolution brain imaging, EEG monitoring, functional neurological mapping. The goal is to identify the exact seizure network inside the brain. Rather than treating epilepsy as one generic condition, clinicians now attempt to pinpoint which brain regions are involved, how seizure circuits spread, whether the epilepsy is focal, generalized, or network-driven. This allows for much more accurate treatment decisions. Pillar 2, genetic precision. The second pillar is genetic precision. Modern epilepsy care increasingly focuses on identifying specific genetic mutations, molecular abnormalities, biological targets causing seizures. Why is this important? Because some epilepsies are now known to result from identifiable gene defects. Instead of simply suppressing seizures broadly, therapies can now target the actual biological mechanism behind the disease. This is one of the biggest revolutions in neuroscience and clinical pharmacology. Pillar 3, third-generation pharmacology. The third pillar is third-generation pharmacology. This refers to the development of newer anti-seizure medications with more targeted mechanisms, better precision, fewer side effects. Traditional anti-seizure medications often affected many brain systems at once. Newer therapies are designed to act more selectively on specific pathways involved in seizure generation. The goal is improved seizure control while minimizing sedation, cognitive impairment, drug interactions, long-term toxicity. The infographic also highlights the importance of modern clinical frameworks. Two major organizations are leading this transition: the International League Against Epilepsy, or ILAE, the American Academy of Neurology, or AAN. Their 2025 to 2026 guidelines emphasize multidisciplinary care, patient-centered treatment, health equity and accessibility, selecting medications based on disease mechanisms rather than trial and error. This represents a major philosophical shift in epilepsy care. At the bottom of the infographic, there's an active learning challenge asking viewers to recall the three pillars of modern epilepsy management. Let's review them again. 1. Diagnostic mapping. 2. Genetic precision. 3. Third-generation pharmacology. These three concepts form the foundation of precision epilepsy medicine. Key takeaway. So what is the main message of this infographic? Epilepsy management is entering a new era. Instead of simply reacting to seizures, clinicians are now focusing on understanding seizure biology, identifying molecular causes, using precision-guided therapies. The future of epilepsy treatment is smarter, more targeted, more personalized, and potentially far more effective. Thank you for watching this breakdown of the new era of epilepsy management. If you enjoyed this medical education video, don't forget to like, subscribe, and share with students, healthcare professionals, neurologists, pharmacists, and anyone interested in neuroscience and clinical pharmacology. See you in the next video.